Marks International Childhood Cancer Day. The Inkosi Albert Luthuli Hospital in KwaZulu-Natal has joined efforts to improve access to organ transplants for children in need of life-saving therapy. Newzroom Afrika's Nobuhle live for us from the Inkosi Albert Luthuli Hospital for more on this important campaign. Nobuhle, good morning to you. The children here are the people that this campaign is targeting. The understanding is that not only do the children need treatment for cancer, but they also need organ transplants. Just talk to us a little bit more about that.
Indeed, Xoli, and that's the most important aspect of today, with today being, International Childhood Cancer Day. And we actually, with DKMS, which is they are a body that are responsible for those donations, and it's one of the biggest ones in the country and in the world, per se, together with that other one. But I want to bring into the conversation Erna West, who is the country manager for DKMS, so she can just tell us about what today is about, number one, and how Inkosi Albert Luthuli Hospital, where we are right now, forms part of your efforts. Thank you very much, Erna. So speak to us about what today is actually about. Why are we here?
So today is really a celebration of our state patient program that we implemented a year ago, together with the fact that we want to create awareness for International Childhood Cancer Day. There are so many children in South Africa that's not even diagnosed, and they obviously then cannot even be treated. So that is the important factor of this day, and that we have to create awareness.
And DKMS, there's been a lot of awareness in the past on social media, especially where you see cases of people and children, like we're saying, that have different kinds of blood cancer, and people don't know that there's a registry like yours that they can put their hand up and say, I want to form part of this registry, so if I can help someone, someone may be helped. Speak to us about how many people you've seen putting up their hands and becoming donors, and successful ones becoming matches. Speak to us about this and how successful the campaign has been.
I must say the last year was actually magnificent. We recruited 22,000 donors in 2022. And the most amazing thing was that 51% of those donors are donors of color. So we know in the past the registry was not representative of the population in South Africa. So typically we would sit with about a 30% ethnicity. We've actually shifted that whole paradigm, and we are so excited about it. And you know what? We saw the impact. We saw donors popping up suddenly for patients not previously that had any previous donors. It's like a miracle. It is really like a miracle. So we are working very diligently. This year we've got a bigger target. We hope that more people put their hands up to become donors. And that is really a miracle that happens in that patient's life. If you think about the state program, we have done it's a little bit over 50 searches. We had 6 submissions, of which one was cancelled. But it just shows you it's a very small number of patients that will get a donor, a matching donor. So this is our problem and our challenge in South Africa, and we have to change it. But we cannot do it on our own. We need partners like Inkosi Albert Luthuli, where patients can be treated as part of the state patient program. But we also need the donors. Without any donors, there's no transplant. There's absolutely no transplant. So we need everybody to put their hand up so that we can save the children.
And then lastly, Erna, just before I let you go quickly, cancer treatment is very expensive, and DKMS being a donor registry kind of helps, with that particular aspect, because when you put your hand up, obviously swab kits have to be sent to you, and all sorts of things have to be done, all sorts of testing. Now that state hospitals like Inkosi Albert Luthuli are now, have been roped in, does this make things easier for those patients who cannot afford such expensive treatment?
Yes, so in South Africa we do have the infrastructure. It's not a massive infrastructure, but we do have it to actually perform these transplants on children and adults. But the donors, if we have donors, like in the state program, we fund it at this stage. DKMS will fund all the unrelated donor costs because the Department of Health isn't doing that at the moment. So that provides access to a transplant.
I'm sorry, I just have to cut you off there. I have to cut you off and cross back to the studio. But yeah, that was Anna West, who is the country manager for DKMS here in the country, which is a donor registry that forms part of, finding those donors for those who are in need of those desperate transplants in the country. Back to you, Koli.
Thank you very much, Nobuhle Madisa, live for us at the Inkosi Albert Luthuli Hospital. A very important initiative indeed. More than